Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. Today, we're going to talk about the Norma Lateralis. Okay? So, students, my students always ask me, ma'am, why should we study the normas? Don't we have enough to do? Yes, you have a lot to do. But the answer to your question is very simple, my dear students. And a student who knows the bones of skull knows the head, face, neck region. So, study your normas, study your mandible, study the humble hyoid to know your head, neck region. So, you've got to study the bones. Okay? So, I'm going to ask you some Viva questions just to show you where you are. Okay? Can you show me the temporal fossa on the skull? Probably you can. What is MacEvan's triangle? Can you write a note on it and its clinical significance? Can you name the structures attached to styloid process? This and many, many more are questions asked on Norma Lateralis. Let's learn a lot about it today. A request to all of you, my dear students. Please keep a pen and paper ready with you so that when you feel like quickly jotting down some points, you should be able to. And keep a skull with a mandible ready like I have done. Okay, so here I have this guy who is ready to rock the class with you today. Okay, he's all come prepped up. He's coming on video today. So you keep the skull and mandible ready with you and let's begin. Right. So let's define the Norma Lateralis. It is the skull as viewed from the side. Okay. What are the bones forming this? Now you don't need me to tell you. Let's see, I think you should be able to manage this on your own. What is this bone in the front? It's the frontal bone. This one on the side, it's the parietal bone. This one at the back, occipital bone. This big one here, temporal bone. Then there are some smaller ones as well, such as there is the sphenoid bone here. I want you to note this. There is a bit of sphenoid bone coming here. Just follow my finger. Okay, this is called as the greater wing of sphenoid. Most of the sphenoid is deep inside, but this greater wing is going to rise up here. Okay, that's called the greater wing of sphenoid. The other bones are the nasal bone, which gets fractured so often, the zygomatic bone, maxilla, and the mandible. All these together form the Norma Lateralis. So we'll now discuss various features one by one. Okay, so let me start with the feature of temporal line. Okay, if you now go to this point here, okay, so on the frontal bone, there is this zygomatic process of frontal bone. Here you see the beginning of the temporal line. As the temporal lines move backwards, you can see them dividing into a superior temporal line and an inferior temporal line. Superior temporal line, if you can see, just blends in at the back. Okay, so that's the superior temporal line just blending in. But the inferior temporal line winds around and becomes continuous below with the supramastoid crest. So you can imagine this. It just winds around and comes back and becomes continuous with the supramastoid crest over here. Thus defining an area which is called as the temporal fossa. Let's see it again, you will understand. Temporal fossa is an area bound anteriorly by the zygomatic bone. Above that, also by the greater wing of sphenoid. Superiorly bound by the superior temporal line. Inferiorly bound here by the supramastoid crest. Okay. And then it is bound by the zygomatic arch. Okay. So just understand that this area here, bound above the zygomatic arch, this area is called as the temporal fossa. Okay. The dotted line is giving you the temporal fossa. Understand that this temporal fossa communicates inferiorly with the infratemporal fossa by passing deep to the zygomatic arch. Can you see the zygomatic arch here? It communicates through a space deep to zygomatic arch with the infratemporal region over here. Right. So now look at this image. Can you see the brown blob? That is indicative of attachment of temporalis muscle. So the temporalis muscle takes origin below the inferior temporal line from the temporal fossa. Attached to the edge of the temporal fossa itself is a temporal fascia which covers your muscle. Better to see than to imagine. Come, take a look. So here is your temporalis muscle, and covering it and getting attached to the zygomatic arch inferiorly is your temporal fascia. So temporalis muscle going down like this, getting attached to the coronoid process of mandible. Can you see this here? This is the muscle getting attached to the coronoid process of mandible. Covered, the whole muscle is covered on the top by the temporal fascia. There are some other contents of the temporal fossa as well. These are deep temporal nerves and vessels. What are they doing there? Obviously supplying the temporalis muscle, which is a muscle of mastication. If you try to chew food and keep your hand here, you will feel the muscle contracting. Do it. Okay? Right. So now, what are the bones forming my temporal fossa? Why are you asking this, ma'am? Didn't we just do the bones forming? Come, I'll tell you why we're doing it. Okay, so here you're seeing the frontal bone, the parietal bone, the temporal bone, and the greater wing of sphenoid. Again, note the greater wing because that's where you don't know, rest you already know. You can see that they're all meeting at an edge-shaped suture. They're all meeting at an edge-shaped suture, which is called as pterion. Please don't say the word P, the letter P, it is silent. It's called as pterion. Question is, what is pterion? A meeting point of four skull bones, FPTS, frontal, parietal, temporal, and the greater wing of sphenoid. Why? What is the peculiarity of this? It is the weakest part of your skull. What lies deep to it? Very important, okay? Asked in the Vivas. Anterior branch of middle meningeal artery along with stem of lateral sulcus lie just below it, okay? How can I mark the pterion? How can I know? So here you are seeing the skull, so you can see the suture. But in a living person, how will you know where is the pterion? You mark a point 4 cm above the zygomatic arch and 3.5 cm behind the frontozygomatic suture. 4 cm above the zygomatic arch, 3.5 cm behind the frontozygomatic suture is your pterion. Question: why should I mark it? What's the use of all this, ma'am? Why are you giving me mathematics in biology? Yes, you have to mark it because this is the point where often a Burr hole is drilled to drain out hematoma in the intracranial region. If there is a hematoma here due to the trauma, then you can make a Burr hole here, which means a hole basically, and drain out the hematoma, preventing blood from compressing the brain. Okay? So that is the clinical importance of pterion. Right. So we are done with the temporal fossa. Let's move down to the zygomatic arch here. Look at the bone you are holding. Palpate the zygomatic arch. Okay, and let's begin a discussion on it. It is formed anteriorly by the temporal process of zygomatic bone. Posteriorly by the zygomatic process of temporal bone. You can, if you look carefully, you can see the suture where they meet also. Okay. If you carry this arch forwards, it becomes continuous with the zygomatic bone. If you carry it backwards, it becomes continuous with the supramastoid crest. Okay. This zygomatic arch has got a very sharp superior border, which we already know gives attachment to a fascia. Which fascia does it give attachment to? Temporal fascia. And outside that, it gives attachment to something called gallia aponeurotica. Now, my dear intelligent students, where have you heard about gallia aponeurotica? Can I give you my mnemonic? SCALP, S for skin, C for deep connective tissue, and A for aponeurosis, gallia aponeurotica, layers of scalp. So it's a layer of scalp that covers my temporal fascia and gets attached to the zygomatic arch. Just like it has an upper border, the zygomatic arch also has a lower border, which along with the inner surface gives attachment to your favorite muscle. Which one? The masseter. Okay, I want all of you to feel your masseter here. Clench your teeth. Can you feel your masseter becoming prominent? A strong muscle of mastication. The lateral surface, the outer surface of the zygomatic arch is subcutaneous. You can all palpate it, isn't it? An inner surface gives attachment to masseter. I want to draw your attention now to the posterior end of the zygomatic arch. See, this is the zygomatic arch. I want you to come here and turn the skull a little bit so that you can observe it also from below. Okay, so here is where I want you to come. As you can see, as the zygomatic arch comes backwards, it divides into a root that goes anteriorly called the anterior root and a root that goes posteriorly called the posterior root. In between them is a beautiful fossa, the mandibular fossa. Okay, the point where the two roots meet, they form a tubercle, which is called as the tubercle of root of zygoma. What is it called? Tubercle of root of zygoma, wherein you will find the attachment of the lateral ligament of temporomandibular joint. Did you understand that we've been slowly introducing ourselves to the temporomandibular joint? We saw temporalis muscle, we saw masseter, muscles of mastication. Then we've just seen the anterior root, posterior root, and we saw the mandibular fossa, into which your condyloid process of mandible comes and articulates. Now you've seen a ligament also, the lateral ligament of temporomandibular joint. This is how osteology builds up a framework for understanding the rest of anatomy. Okay, fine. Let's take it forward. Structures that pass through this gap. Okay, what are the structures that will pass through this gap deep to the arch? You already know one structure, a muscle descending down called temporalis. Very nice. Structures going up to supply the muscle, deep temporal nerves and vessels. There is your answer. Logic makes it much easier to remember. One muscle temporalis, nerves deep temporal nerves and vessels deep temporal vessels. Fine. So now, what is the next thing we should go to? I want to discuss the external acoustic meatus here. Okay. So now, the external acoustic meatus, as you can see, is inferiorly and anteriorly and posteriorly supported by a bone called the tympanic plate. Okay. Such that the walls of external acoustic meatus are formed by tympanic plate anteriorly, inferiorly and little bit in the posterior part. Whereas the squamous part of temporal bone forms the posterior-superior boundary. Rest of the boundary is formed by tympanic plate. Posterior-superior formed by squamous part of temporal. Note that external acoustic meatus has two parts. A deeper bony part, a superficial cartilaginous part. When you are born or when I was born, the bony part had not developed. It develops with time. Okay, now this is having applied importance. I want you to find out why it's important to know this and put it in the comment section. Okay, fine. So now let's talk about the suprameatal triangle or MacEvan's triangle. That was the note I asked you about. Now this is a tiny little triangular area found here, just behind the external acoustic meatus. Let's see it here for you to understand better. It's a triangle bound anteriorly, okay, or let's bound superiorly by the supramastoid crest, okay, anteriorly by the posterior wall of the external acoustic meatus. Okay, so superiorly by supramastoid crest, anteriorly by external acoustic meatus, and posteriorly by a tangent drawn to the external acoustic meatus. Tangent, I mean, you've done tangents long time ago in mathematics, but just understand that you are drawing a line perpendicular to an arc at the edge of the arc, passing it upwards. The triangle that is thus formed, take a look here, is called as the suprameatal triangle. So now you must be wondering, madam, why are we doing all this? Do we really need to know? Yes, you need to know. Why do you need to know? Because this triangular region overlies your mastoid antrum. If you recall, mastoid antrum is a pneumatic bone. A lot of tiny little spaces in it. Infection, once it enters into it, becomes very difficult to drain out. So what you do is you pass through this space, suprameatal triangle, drilling a hole about 12 to 15 millimeter deep to drain out the infection. Okay. Note that in a child, this depth at which the mastoid antrum exists is barely 2 millimeter. As the child grows older, almost a millimeter is added every year till it reaches the adult depth of 12 to 15 millimeters. Have you got it? That is the suprameatal triangle. Right. Let's now come to this nice little solid projection called the mastoid process. All of us can feel it behind the ear, isn't it? This mastoid process gives attachment to our favorite muscle. Ma'am, you call every muscle as favorite. Now, this one truly is favorite. Okay, it's the sternocleidomastoid, the first one we learned in head neck region. Also below it, there's attachment of splenius capitis and the longissimus capitis. So, three muscles attached to the mastoid process. Okay. But you also find a notch here. I hope you can see that there is a deep notch here. This notch is called the digastric notch. It's where the posterior belly of digastric takes origin. So mastoid on the outside gives attachment to three muscles. On the deeper side to the posterior belly of digastric. Funnily, this process is not developed at birth. It's only the pull of the sternocleidomastoid that causes it to develop. Now you find a little mastoid foramen through which your emissary veins communicate the posterior auricular vein with the sigmoid venous sinus on the deeper side. You can see the foramen here. And then you find a point called as an asterion. I want you to remember what are fontanelles, okay? And which fontanelle is this ossified form of? It's a point where three sutures meet. One suture is the lambdoid suture, the second paritomastoid, and the third occipitomastoid. The point where these three sutures meet is called Asterion, and it is the ossified part of the posterolateral fontanelle seen in the fetus. I have taken a class on this in Norma Verticalis. Please go refer to that class to understand what are fontanelles and what is their applied importance. Right. Let's now come to the beautiful styloid process present over here. Okay, you can, many times on the skull you will find the styloid process broken, but the little lower end of it is always there. So, what is this lower end? What is this upper end? Take a look. So, here is your styloid process. As you can see, it is covered by the tympanic plate. Here is your styloid process covered by the tympanic plate. So, it has a free part and a covered part. The covered part is called tympanohyal and the free part is called as the stylohyal. Okay, from the stylohyal begin a lot of stylo muscles. Okay, so let's come to what is attached. What are the three muscles attached to the stylohyal part? One muscle going from the styloid process to the tongue, styloglossus. To the hyoid bone, stylohyoid. To the pharynx, stylopharyngeus, three muscles. To ligaments also. What are the only two bones which are moving in the skull? One is the hyoid, stylohyoid. Second is the mandible, stylomandibular. Two ligaments that hold these bony parts together. Okay. So all these, because there are so many muscles attached, okay, these are called as the styloid apparatus. Okay. So three muscles, two ligaments. Coming from the tip is the styloglossus. Coming from the upper posterior part is the stylohyoid, and from the medial side, stylopharyngeus. Similarly, from the tip, stylohyoid ligament, and from the upper lateral region, stylomandibular ligament. Please remember this, asked repeatedly in exams. Right. With this, we come to the last part of today's discussion, the infratemporal fossa. This is going to test you, my dear students, because it does need imagination and determination both. Where is it? Infratemporal fossa, below the temporal region. Temporal fossa, infratemporal fossa. So it lies below the temporal fossa. It's a space actually which is bound lying below the middle cranial fossa. See, understand that this is the middle cranial fossa. It lies below the middle cranial fossa. behind the body of maxilla. This is the maxilla, it lies behind it. Lateral to the lateral pterygoid plate. This is the lateral pterygoid plate here. And medial to the ramus of mandible. Now take a pause. Take your mandible. Articulate it. And this space here, where my finger is now disappearing, is your infratemporal fossa. I'm going to remove the mandible because it becomes very cumbersome to understand with the mandible articulated. Okay? So just understand, revise it once. Superiorly bound by the middle cranial fossa, behind the body of the maxilla, lateral to the lateral pterygoid plate, and covered from the outside by the mandible, ramus of mandible. Let's study it a little better. I have clearly written where is your infratemporal fossa to keep that as an orientation, and let's go forward. It has a roof and a floor. Okay, so the roof is formed by infratemporal surface of greater wing of sphenoid. See, this was your greater wing of sphenoid, remember I told you. And this surface is its infratemporal surface, which forms the roof of my infratemporal fossa. Funnily, if were I to turn this, I will find that this roof is pierced by two foramina. Can you see these? Can you identify them? Yes, they are the foramen ovale and the foramen spinosum. That means in my infratemporal fossa, I am going to get contents which are passing out from the skull from the foramen ovale and foramen spinosum. Posteriorly, this roof is continuous with the temporal fossa. Okay. Inferiorly, the floor of the infratemporal fossa is open. Okay, so there is no structure forming the floor, there is only the roof, which is formed by the infratemporal surface of the greater wing of sphenoid, along with foramen ovale, foramen spinosum present deeper, and then a space through which it communicates superiorly with the temporal fossa. Floor is non-existent, it is open inferiorly. Let's come to anterior and posterior boundary. As you can see, the anterior boundary is formed by the posterior surface of the maxilla. If you go looking carefully, you will find that at the upper end of this, there is a little fissure called the inferior orbital fissure, through which this infratemporal fossa communicates with the orbit. Now look in the orbit in the skull that you have. Inferiorly, you will find that there is a clear fissure, which is communicating down with the infratemporal fossa. Okay, this is for you to do on the skull. Okay, it's fine for me to keep showing it to you here, but unless you see it on the skull yourself, you won't understand. So, this space, infratemporal fossa, communicates superiorly through the inferior orbital foramen with your orbit. Okay. Posteriorly, it is free. There is no posterior wall to this fossa. Finally, we come to medial and lateral boundaries. Medially, you already know, it shows it is related to the lateral pterygoid plate. Now look carefully, zoom in and see that there is a little fissure here. Can you see the fissure? This is the fissure which exists between the maxilla and the lateral pterygoid plate, called the pterygomaxillary fissure, through which contents from here communicate with the pterygopalatine fossa. Lot of stuff, madam, you're adding too much. I agree with you, I'm adding too much. But that is the amount of stuff you have to know about Norma Lateralis. But revisions help, isn't it? So let's revise. Let's revise the communications of infratemporal fossa. It is anteriorly communicating with the orbit through the inferior orbital fissure. Who is going to communicate? What are the structures communicating? The structures can be orbital branch of pterygopalatine ganglion, zygomatic branch of maxillary nerve, infratemporal nerves and vessels. Remember, they pass through it and finally emerge over here through the inferior orbital, infraorbital foramen. We've done this earlier. And veins which will be communicating the inferior ophthalmic vein with the pterygoid venous plexus. Right. Next communication is when the infratemporal fossa directly communicates with the temporal fossa. You already know through this space one muscle comes down, temporalis. One nerve and vessels go up, deep temporal nerves and vessels. So you know what is communicating with what through this gap. The third communication it has is through the pterygomaxillary fissure with the pterygopalatine ganglion. Okay, now this is very interesting. I want you to sometime sit and stare into that little gap. I've done it and I found that it was very interesting. Okay, try it out. There's no point in there's no way your camera is going to look inside. But when you look inside, you find it's amazing. What is happening in that little place there? It's amazing. You can take a little wire and just go in and try and make it out and come out of various foramina. It will be fun, students. I hope at least 10 of you do this. Okay, so it communicates with the pterygopalatine ganglion through the pterygomaxillary fissure. Okay. So what passes through? Same question. So what passes through is the third part of maxillary artery, the maxillary nerve. The posterior superior alveolar nerves that emerge out and supply your superior alveolar margin and the pterygoid venous plexus. Now question is, what are the contents of this fossa, which is supposedly so interesting? What are the contents of the fossa? I think the upper aspect gives you an idea of the contents. Third part of maxillary artery is entering in. So will it be a content? Yes, it will be a content. The maxillary nerve is there, so that will be a content. And there is something called as a pterygopalatine ganglion. That is also a content. Let's see if I am right. Yes, third part of maxillary artery, maxillary nerve, and pterygopalatine ganglion are contents of this fossa. Okay. Finally, then what is present in my infratemporal fossa? So many contents we've talked about, ma'am. How do we remember what is the content of the fossa? Always remember, any area always contains muscles, arteries, nerves, lymphatics. Okay. And maybe one odd additional structure. So what muscles did we see? We saw masseter on the outside and we saw temporalis on the inside. So basically I am going to see muscles of mastication. Fine. Now I saw some nerves. If there is muscle, there has to be nerve supply. These muscles are supplied by the mandibular nerve. And remember, foramen ovale allows passage of mandibular nerve here. So that has come. So I will see that. I will also see an otic ganglion, which is a ganglion found in relation to the mandibular nerve. One nerve we've been all banding about in last 2-3 minutes, the maxillary nerve. Okay. And also present here is a friend of lingual nerve, the chorda tympani. So all these are nerves present in this region. Some things you have to remember, the rest you should use logic. Fine. Arterial supply, you saw third part of maxillary artery in the pterygopalatine fossa. Where is the first and second part, ma'am? It's in the infratemporal fossa. Okay. So infratemporal fossa contains the first and second part of maxillary artery along with its branches. If there is an artery, there has to be a vein. So which venous plexus? Pterygoid venous plexus. Now ask yourself, do you know the contents of infratemporal fossa? Yes, you do. Muscles, nerves, arteries, veins. Okay. This is how using your osteology helps you to understand the gross anatomy. But you have to do it in a way that you understand and enjoy it. Don't just do it because there are 4 pages in Chorosia given on Norma Lateralis. Do it because you want to use this to understand the gross anatomy. Right. So this is just the mind image that I have created. I've always imagined my infratemporal fossa as a cube. And the roof of the cube is pierced by structures entering temporal fossa, and medial wall is to the pterygomax, the pterygopalatine ganglion, and so on. Each of us has our own tricks of studying. Mine I'm sharing with you. I don't know, it might seem very silly to you, but that's how I have understood infratemporal fossa, and that's what I feel like sharing with you. Come up with your own mind images, but use them to learn. Right. So with this, I end this rather material heavy class on Norma Lateralis. Students, since we're talking about bones, to achieve something, the backbone is often more important than the wishbone. I'm sure you understand what I'm saying. Wishing is fine, but you've got to put your back into it to achieve, isn't it? So again, great fun taking this class with you. Yes, you're going to find that this class was a little challenging. So revise it again and again, and maybe you can even put up your doubts on comment section. I'll be more than happy to come forward and explain whatever doubts you have and clarify them. The aim is to enjoy anatomy, to understand anatomy, and keep learning and recalling anatomy. Okay? Thank you, students. I had fun. I hope you did too.